call the meeting to order at 5 p.m. Before we begin, I would like to acknowledge that we are meeting on the unceded traditional territory of the Algonquin Anishinaabe people. We honor their enduring presence on this land and their continued stewardship of the lands and waters of this region. I will now conduct the roll call. Member Bauer?
Present.
Member Carr?
Present.
Member Chung? I see you online, Member Chung. Member King?
Here.
Member Bradley?
Here.
Member Dudas? I'll put it here. Member Gower? And Member Ejiofor. Chair Kitts? Here. And Vice Chair DiGiovanni.
Present.
We have quorum. We have no regrets this evening. However, Member Gower will join us a little bit later than expected. Do we have any declarations of interest this evening? Seeing none, I'm looking for a mover for the confirmation of the meeting minutes on December 1st, 2025. Moved by Member King. All in favor? You. Communications, we have one which will be held on record by me. And Member King, can we have the motion to introduce reports?
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Update on the Revised Ontario Public Health Standards, Emergency Management at Ottawa Public Health Annual Update, and 2026 Governance Review Report for the Ottawa Board of Health be received and considered, and be it further resolved that the rules of procedure be suspended to permit the agenda to be amended to introduce the report titled Election Confirmation of the Chair and Vice Chair for 2026 for consideration at today's meeting.
Thank you, Member King. So we will now go through the consent agenda process. For those who may not be familiar with this process, I will list each item on the agenda. And for items which board members do not have any questions or concerns or motions, and for those items we do not have public delegations registered to speak, the board may carry or receive those items on consent, which to say without any discussion. So the first item, 7.1, confirmation of the chair and vice chair for 2026. Is that carried?
Sure.
Thank you. We will hold item 7.2 and 7.3 for the verbal reports from the chair and the chief medical officer of health. Item 7.4, the update on revised Ontario public health standards. Is that received? Received. The next item, item 7.5, emergency management at Ottawa Public Health annual update, we will hold for a public delegation. And item 7.6, the governance review report for the Ottawa Board of Health, we will also hold for comments from the chair. And with that, back to you, Chair.
Thank you very much, Board Secretary. Thanks everyone for re-electing me to the chair. Kwe, Anin, Shekhan, Tanshi, Unukut, and good evening, everyone. And even though it's February, welcome to a brand new year. It's our first Board of Health meeting in 2026. So as many of you know, 2026 is also an election year for municipal government, and this marks the final term for our current Board of Health, an important moment filled with both potential impact and fresh opportunity. Dans les mois à venir, nous aurons l'occasion de façonner des améliorations à long terme en matière de gouvernance de la santé publique, d'approfondir les partenariats de collaboration et d'amplifier notre rôle de chef de file dans le paysage municipal et provincial d'Ottawa. In January, Dr. Arneson and I attended the Rural Ontario Municipal Association's annual meeting. This was an excellent opportunity to connect with colleagues from hundreds of rural municipalities across Ontario and to discuss key issues facing rural communities, including access to health services, community safety and well-being, and the importance of well-supported public health units. Our participation is always a valuable reminder to both our colleagues and to our provincial colleagues of Ottawa's unique geography and characteristics. Despite being the second most populated city in Ontario, we are also 80% rural. While at the conference, Dr. Arneson and I had an opportunity to meet with the Deputy Premier and Minister of Health, Sylvia Jones, to discuss our ongoing budget pressures and the growing funding contribution gap between the city and the province. During that meeting, I underscored how, in spite of our funding and budgetary pressures, public health units and OPH in particular are making critical contributions to the Minister's health strategy, Your Health, a plan for connected and convenient care. Investing in local public health is a low-cost and highly effective way to support the province's efforts to transform the health system. Public health programs are preventative by design. They focus on keeping people healthy in their communities, and in doing so, they help reduce demand on primary care, emergency departments, hospitals, and long-term care. The minister was unable to provide further details on the next steps in the province's review of public health unit funding. I remain focused on the province's commitment to restore the funding ratio for public health units and will continue to advance this board's position with our provincial colleagues. I will update you as the process progresses. Looking ahead, this year also marks the conclusion of OPH's current strategic plan, an important milestone. Les conversations que nous aurons dans les prochains mois contribueront à définir les priorités pour le prochain mandat et à jeter les bases d'un nouveau plan. This year will offer many opportunities for us to connect as a board and learn outside of formal meetings. Board members will have access to a variety of workshops and engagement sessions, both in person and online, that provide valuable insight into OPH's day-to-day work. OPH staff will soon share their engagement calendar, which was well received last year, so thank you for everyone who participated. We'll also have the opportunity to participate in Alpha's Winter Symposium in February, and later this spring, gather for a retreat focused on shaping the next strategic plan. These opportunities are essential for building knowledge, strengthening relationships, and fostering collaboration. In support of OPH's strategic plan, creating the conditions for people to live well and thrive through the built environment, I'd like to share that Council has improved Ottawa's new zoning bylaw. This is a once-in-a-generation effort to rewrite the city's rulebook for what can be built where. Years in the making, it includes things like housing types, building height and setbacks, and what uses are allowed in different places. It is a major step in implementing the new official plan. Ottawa Public Health has worked alongside the city's planning department to bring a public health and equity lens to the rules that shape our neighborhoods. The new zoning framework supports more housing choice and the ability to add homes and more density in existing communities. From a health perspective, it supports more walkable 15-minute neighborhoods with daily needs closer to where people live, thus promoting active transportation. It strengthens provisions to enable trees in communities, helping to reduce urban heat islands, and aims to support active transportation. Il lève également les obstacles qui limitent auparavant l'implantation de logements sociaux et de logements de transition. OPH will continue to work with the city on implementation and through other planning tools that shape healthy built environments. Finally, as we mark the start of Black History Month, I want to take a moment to celebrate the richness of Ottawa's Black history and culture. Throughout February, there are a myriad of opportunities to learn about the history of Black communities in Ottawa. Participate in town halls and dialogues, and engage in dialogue and reflection on the experience of Ottawa's Black community. I encourage board members, residents, and OPH staff to attend and support them. For more information on Black History Month events happening across Ottawa, please visit Black History Ottawa's event calendar. While this is a time to celebrate, it's also an opportunity to reflect on the systemic barriers that continue to affect Black health outcomes. I look forward to working together to elevate these conversations this month and throughout the year ahead. Cela conclut mon rapport verbal, and I would be happy to take any questions. Seeing none, is this item carried? Great. Thank you, everyone. On to item 7.3, Medical Officer of Health Verbal Report.
Good evening, Kwe, Unusakut, Tanshi, Ani, et bonjour. I'd like to start by welcoming everyone back this year. I hope you all had a restful and enjoyable holiday season. As we begin a new year, I look forward to continuing our important work together to advance the health and well-being of the community. This year brings opportunities to strengthen partnerships, address emerging public health challenges, and build on the progress we've made. Merci pour votre engagement et votre dévouement. J'ai hâte de voir ce que nous ferons ensemble dans la dernière année de votre mandat. Black History Month, as was mentioned, is a time for honesty and accountability. It calls on us to confront how anti-Black racism is embedded in systems and beliefs that continue to shape inequities in access and quality of care across generations. It is also a moment to recommit to action. On November 20th, 2025, our city witnessed the proclamation of the Ottawa Declaration on Black Health in Canada during the high-level roundtable and National Vision for Black Health. Led by the Interdisciplinary Centre for Black Health at the University of Ottawa, the declaration sets priorities for improving Black health over the next decade and outlines concrete actions to address long-standing inequities. These include recognizing racism as a determinant of health, adopting zero tolerance for anti-Black racism in health systems, investing in youth mental health, advancing reproductive health equity, improving food security, and strengthening community infrastructure. I commend the leadership behind this work, and I'm pleased to share that OPH has signed the declaration, reaffirming our commitment to addressing anti-Black racism and our board's previous recognition in 2020 of racism being an important public health issue. Nous continuerons à travailler en partenariat avec les communautés noires, à apprendre de leur expérience et à mieux comprendre et régler les causes des inégalités en santé. With winter now well underway, I want to highlight a few health considerations for Ottawa residents. We've had a particularly intense flu season this year compared to recent years, with a rapid increase in influenza cases and influenza-related hospitalizations in December. And the peak of influenza activity coincided with the holiday period. Older adults and children are two groups who have been disproportionately impacted by influenza this season, including the unfortunate deaths of 3 children due to influenza A-related complications in Ottawa and Eastern Ontario in December. While hospitalizations related to respiratory illness were above average for several weeks, in more recent weeks, declining influenza activity alongside low levels of COVID dropped hospitalizations related to respiratory illness below average, despite continued high RSV, or respiratory syncytial virus activity. While RSV activity remains high, we have seen fewer infants and young children in Ottawa hospitals with the virus this season compared to previous seasons, showing the continued benefits of the infant RSV prevention program. Immunization continues to be the best protection against severe illness and complications of flu, COVID-19, and RSV, especially for older adults, young children, pregnant people, and those with chronic conditions. We continue to recommend that Ottawa residents stay up to date with immunizations and practice prevention, frequent hand washing, covering coughs, and staying home when sick. Nous sommes également conscients que les mois d'hiver peuvent être difficiles pour la santé mentale. Les journées sont plus courtes et plus froides, et il peut être difficile pour certaines personnes de sortir et de garder le contact avec les autres. Passer du temps à l'extérieur pendant la journée, rester actif, même avec une courte promenade ou des exercices à l'intérieur, et pratiquer la pleine conscience sont de bonnes stratégies pour améliorer l'humeur et le niveau d'énergie. Feelings of isolation or low mood are common at this time of year, and support is available for anyone who needs it. Locally, the Distress Center of Ottawa and region offers 24/7 phone support at 613-238-3311, as well as text and chat options daily from 10 a.m. to 11 p.m. The Ottawa Mental Health Crisis Line is also available 24/7, and youth can access the Youth Services Bureau Crisis Line. Additionally, the National 988 Suicide Crisis Helpline is now answered locally and available in both French and English. Please reach out for help if you need it. Asking for help is a sign of strength. I'm also pleased to share that the Ottawa Hospital Research Institute, in partnership with OPH, has received federal funding over the next 4 years to advance dementia prevention in our community. Risk of dementia increases as people age, and with a growing older adult population in Ottawa, the number of people developing dementia is expected to increase. The recent 2024 Lancet Commission Dementia Prevention Report estimates that up to 45% of dementia cases are linked to 14 modifiable risk factors, emphasizing the need to identify and implement prevention approaches. L'Institut de recherche de l'hôpital d'Ottawa a développé un calculateur de démence permettant de prédire le risque de développer une démence chez les personnes de 55 ans et plus. Il utilise des facteurs de risque que l'on peut modifier. Cet outil peut aider les gens à mieux comprendre leur santé cérébrale et les mesures qu'ils peuvent prendre pour prévenir ou retarder l'apparition de la démence. OHRI will develop an Ottawa-specific population-level dementia risk report using national survey data. This will help us understand the impact on the community and support planning for prevention. OPH will support this project by working with local community partners and older adults with lived experience to define low, medium, and high-risk recommendations for prevention and pilot a prevention program within neighborhood health and wellness hubs. Following implementation in Ottawa, the team will develop a national toolkit to help scale dementia risk reduction efforts across Canada. Before I conclude, I want to take a moment to recognize Cameron Keys, our Director of Quality, Epidemiology, Strategy, and Technology, or QUEST branch, and an important member of OPH's senior leadership team. Cameron has announced his plans to retire from Ottawa Public Health with his last day on April 29th, 2026. Since joining OPH in 2019, Cameron has been instrumental in strengthening our strategy, planning, and quality improvement. He played a key, critical leadership role during the COVID-19 emergency response and helped shape our transition back to routine operations. Under Cameron's leadership, Quest became a cornerstone of our organization, advancing evidence-based decision-making, modernizing digital systems, and embedding continuous quality improvement across programs. His thoughtful approach, practical leadership, and commitment to collaboration have left a lasting impact on OPH. Cameron, we will miss your presence at board meetings and your invaluable advice always, but we certainly wish you a healthy, fulfilling retirement, and you do look very happy there, so that's good to know. Please join me in thanking Cameron for his outstanding service, and that will conclude my verbal report, and I'd be happy to take questions.
I would like to just add on behalf of the board, we're all so happy for you. You will be missed, but please enjoy your well-deserved retirement. And we'll take any questions for Dr. Arneson if there are any. Seeing none, is this item received? Great. Thank you, everyone. So on to our next item, which is emergency management at Ottawa Public Health annual update. We do have one delegation, so we will invite James McKillop. You have 5 minutes up at the mic. I'll just remind you, you have 5 minutes.
Yes, hello. I'm James McKillop, and I'm here tonight to express my concerns regarding pandemic preparedness with Ottawa Public Health and biodigital convergence surveillance systems. Meet Robert Delatola, professor at U of O and CIHR Public Health and Environment and Climate Change and One Health. Delatola Research Group focused on advancing wastewater environmental monitoring as an early system for pandemic preparedness, using anonymous and non-invasive tools to advance equity in Canada and worldwide. These, according to IEC and ISO, Delatola's environmental monitoring include smart sensors, digital water, smart cities, and cloud-based telemetry. These smart sensors include biosensors in everything, including drug discovery, pathogen discovery, soil monitoring, food quality, environmental monitoring, and disease detection. These biosensors and quantum sensors use specific biochemical reactions by isolated enzymes, immunosystems, tissues, or whole cells to detect chemical components using electrical, thermal, or optical signals. WB biosensors for public health can be used to monitor drug consumption, pesticide, metal exposure, surveillance, and early warning of infectious diseases, even food safety. According to another surveillance company in Ottawa, Can Immunize has been developing immunization software for a decade, long before COVID was unleashed on the world. 10 years ago, Wilson's team at the Ottawa Hospital created the first digital immunization app in the world. The solution was initially for Ontario, but then federal funding took it across Canada and made it cloud-based. Welcome to CoVARnet, Canada's blueprint for pandemic preparedness. CoVARnet builds strong relationships with all sorts of government agencies, including regular interactions with Health Canada, Public Health Agency of Canada, and the National Microbiology Laboratory. CoVARnet ensures the maintenance of pandemic research infrastructure. Examples: biobanking, data platform, and bioethics. Biobanking is recognized as a cornerstone of biodigital convergence, acting as the vital link where physical and biological materials are digitalized, analyzed, and integrated with computer technology. These databases have expanded to other viruses for public health surveillance. CCABL3 provides a central hub for academic biosafety level 3 labs in Canada, bringing together key leadership from the Public Health Agency of Canada. These labs not only swiftly generate crucial data and inform vaccine strategies, but also rapidly address emerging pathogens. Many labs have developed innovative technologies during the pandemic to continuously monitor and maintain preparedness to address public health threats. CDAR is a CoVARnet's Indigenous engagement in research. WWSRG is recognized as a global leader in wastewater environmental surveillance and has significantly strengthened Canada's surveillance capabilities and has proven indispensable as part of a comprehensive public health strategy. WWSRG paved the way for more data-driven public health decisions globally. Just like to point out Vera Etches, medical officer at OPH at CoVARnet. Meet Crystal Vander Elst. Crystal Vander Elst, Director General Policy Horizons, CEO of the Global Foresight Group. This report from Policy Horizons called Foresight on COVID-19 Possible Shifts and Implications. How might new Policy Horizons gets into a whole bunch of things in this report. The most interesting is that Policy Horizons claims COVID is a naturally occurring virus, although many would disagree with that. But Crystal also believes it's possible that pathogens could be created and released intentionally or unintentionally. It seems it became more likely with the ability to sequence microbial genomes and to synthesize genetic materials cheaply, like CoVARnet just so happens to be doing. Policy Horizons also believes that the best practice is to identify, isolate, Oh, no, I'm not. Identify, isolate, and treat COVID-19 could prove invaluable in responding to the intentional introduction of a synthetic biology pathogen. Policy Horizons Biodigital Convergence Report explores the broader context in which we might experience and manage biorisks and opportunities. Canadians have supposedly grown accustomed to these tech innovations. I'd just like to say I haven't. Policy Horizons...
I'm so sorry to interrupt you, but that is your 5 minutes. So we'll just see if there's any questions for you. I'm not seeing any, but thank you very much for coming out this evening.
No problem. Thank you.
Thanks. Okay, thanks everyone. Is this item received? Wonderful. Thank you. So the next item is 7.6, 2026 Governance Review Report for the Ottawa Board of Health. And I just wanted to hold it for a couple quick remarks. Hopefully you've had a chance to look through it. I know you have, but I wanted to highlight a couple of the elements before opening the floor to any questions. This year's review was a team effort, and I would like to thank our board secretary, Casey, who worked closely with our shared services partners, including the city clerk's office and legal and financial services, to look at our bylaws and policies in the context of recent legislative updates, ombudsman recommendations where relevant, city policy changes, and the evolving needs of our governance practices. This collaborative approach is helping to ensure that we as a board stay aligned with current municipal standards and keep our processes clear, modern, and effective. Before getting into the proposed updates themselves, I also want to take a moment to acknowledge the results of our governance self-evaluation survey. The survey was completed anonymously and we had a strong participation rate. So thank you to everyone who took the time to share your feedback. Your responses were incredibly valuable in shaping this review and in planning our governance work for 2026. And as part of the process, I'll be working with the board secretary and the medical officer of health over the coming months to schedule follow-up discussions with board members on the results so we can ensure all board members feel supported, informed, and confident in their roles. So with that context in mind, I'd like to go over the key updates to each of the policies and bylaws included in this year's review. The procedure bylaw has been updated to strengthen hybrid meeting procedures, including clear steps for managing connectivity issues and maintaining quorum. It also clarifies how public delegations are handled, generally limiting them to published agenda items while allowing a narrow exception when an urgent matter arises during verbal updates and the board agrees to hear it. These changes support fairness, equitable access, and predictability at our meetings. The delegation of authority bylaw now aligns with the city's current sponsorship policy and includes enhanced ethics and conflict of interest provisions, clearer thresholds for sponsorship and naming rights decisions, and an annual reporting requirement. These updates reinforce transparency and oversight in financial matters. The updates to the Code of Conduct clarify conflict of interest expectations and introduce guidance for digital conduct covering respectful online engagement, confidentiality, and use of official roles and titles. Basic expectations for virtual meeting professionalism are also included to support consistent conduct in virtual environments. The travel policy has been clarified so some members have a better understanding of eligible expenses, approval routes, documentation requirements, and reimbursement timelines. It now explicitly includes accessibility accommodations to support full participation by all board members. The medical officer of health performance appraisal policy has been adjusted to align with the city's calendar year cycle, with appraisals completed in the first quarter for the preceding year. This improves consistency and broader city processes. Finally, the report recommends that the board adopt the city's election-related resource policy, applying it to all board members, including citizen members, to ensure that public resources are not used for any election-related purposes in accordance with the Municipal Elections Act. Together, these updates strengthen the clarity of our governance framework, modernize our procedures, and reinforce accountability and transparency in how we conduct board business. So I will like now to open the floor if there are any questions about any of that. Seeing none, I will call on Member King to read the motion to carry the report recommendations. You have that?
That the Board of Health for the City of Ottawa Health Unit, number one, receive the information, the governance self-evaluation and policy review 2026 report attached as document 5, approve amendments shown in document 1 to the Board of Health procedure bylaw. 3, approve amendments shown in document 2 to the delegation of authority bylaw. 4, approve amendments shown in document 3 to the code of conduct to align with the city's current framework, clarifying conflict of interest processes and expectations for digital conduct and social media. 5, approve amendments shown in document 4 to the travel policy. And 6, amend the medical officer of health's performance appraisal policy to align with the city's calendar year cycle with completion of the appraisal in Q1 of the preceding year. And 7, adopt the City of Ottawa's election-related resource policy as described in this report and attached at document 6, and confirm that the purposes of the Board of Health, this policy applies to all board members, including citizen members.
Thank you very much. Is this carried?
Carried.
Wonderful. Thank you, everyone. There's been no information previously distributed. We have no in-camera items. So motion to adopt reports. Member King.
Be it resolved that the chair of the Board of Health verbal report, the medical officer of health's verbal report, and the reports titled Confirmation of the Chair and Vice Chair for 2026, Update on the Revised Ontario Public Health Standards, Emergency Management at Ottawa Public Health Annual Update, and 2026 Governance Review Report for the Ottawa Board of Health be received and adopted.
Thank you. Is this carried? Great. We have no motions of which notice has been previously given. We have no motions requiring suspension of the rules. Are there any notices of motion? Seeing none, confirmation bylaw, please.
Be it resolved that the confirmation bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of February 9th, 2026 be read and passed.
Is this carried? Great. Thank you very much. Do we have any inquiries? No. Nice quick meeting. We are adjourned. The next meeting is Monday, April 20th. Thank you everyone for coming out tonight.